I have some lovely varicose veins. I didn't even know it was possible to have varicose veins there. It's making me consider wanting to go to a different ultrasound clinic. I'm just gonna prepare for this baby to possibly come earlier. Hello everybody, it's Delilah and welcome back to my channel. Today's video is going to be my 29-week pregnancy update. I'm filming this a few days earlier than I usually do just because I'm coming down with a cold and I'm scared I'm not going to have a voice in the next couple of days, so bear with me. I managed to put makeup on, but my hair is not going to be done and my throat is very sore, so I'm going to try to get through this pregnancy update without having to talk too much. This little lady just fell and tripped and apparently was very traumatic. She is going to be sitting with me for a portion of this video. We'll see how well this goes. So this is what baby looks like this week at week 29. It is very big. It takes up pretty much the entire screen. The app that I use is the Pregnancy Plus app, and while I'm at it, you guys ask me about this phone case all of the time. It is from Case app, in case you're wondering. So at week 29, the baby is about 15.7 inches in length and about 2.9 pounds. Your baby is now able to see, and even though it's dark inside your uterus, the eyes are wide open and scoping out the environment. Your baby's brain is growing rapidly, due to which it will not gain much weight or height this week. Red blood cells are now forming in your baby's bone marrow. Your baby is shedding the lanugo present on the skin. However, the hair on your baby's head is actually growing thicker at this point. Fluid is now present in the air sacs inside the lungs to help your little one take that first breath at birth. Your baby may begin to position itself for birth anytime from now on. You want to go? So there are some big changes that have happened in the past couple of weeks, some big things I want to update you on. I had a prenatal checkup about a week ago, and there's some interesting things that I need to mention from that appointment. Also, I'm just going to forewarn you, all these pregnancy updates are probably going to be TMI because that's just what pregnancy is. That is just life while pregnant and after giving birth. It's all just TMI. I am feeling all kinds of different movements. With my daughter, I didn't feel a ton of movement. Like I definitely felt a lot of movement, but it was more so like she would just stick her bum out all the time and kick me in the ribs constantly. This baby's a bit different. I'm feeling the same movements of like the bum sticking out all the time, but something I'm feeling that's very different is the heel running across my stomach. I swear I could almost grab that heel sometimes and just like move it around my stomach. It's so crazy to feel, so cool. I don't know if the baby is just like pushing its heel out really far or if it's in a sensitive spot sometimes, but every once in a while it hurts. Some days the movements are very kind of slow and kind of like it's just stretching and moving around, and then the next day it's like it's having a little dance party in there and I'm feeling all kinds of crazy like short quick movements. So I'm thinking that probably means that baby is still kind of turning and moving around in there, but I am feeling most of the movement up like around and above my belly button. I often feel movements on both sides of my stomach at the same time, but whenever I do feel like that heel roll across my stomach, it's always on the right side of my stomach, and sometimes it goes like really far back and it almost feels like it's going into my ribs. I'm feeling every possible kind of movement I feel like with this child. I haven't been quite as short of breath in the past couple weeks. I mentioned in the last update that was so bad. I was always short of breath. I could like hardly talk or hardly eat without having to just pause and take a breather, but it's getting better. I think baby has moved into a different position now where it's just less pressure on my lungs. Something interesting I made note of is that this past Saturday during the night I had a really rough sleep, and every time I would like flip over to my other side I was in a lot of pain down there, and I'm pretty sure overnight somehow my pelvic bone or something separated even more. That entire day at least I was feeling like, you know, in a bit of pain. I felt a little wobbly. It just kind of feels like my bones are separating, preparing for birth, which is totally normal. Some days are worse than others. I wouldn't say I'm in excruciating pain. It's more so just uncomfortable, and then some days I'm in a little bit more pain than other days, and it's not like it's constant pain either. It's mostly just like when I'm walking or when I'm sitting on the toilet for some reason, or if I were to like squat or like separate my legs a little bit more while I'm standing, that's when it would hurt a little more. Apologies for the quality. I'm using my phone right now because I don't have a camera in reach, and being pregnant and not feeling that great, I don't want to get out of bed. I was just editing the video and I realized there's something that I forgot to mention that I wanted to mention. I felt baby's hiccups for the first time on that same night that I didn't sleep very well. So on Saturday night, I felt baby hiccup for the first time, and it was crazy because baby was hiccuping so fast. Like, so fast. It was almost concerning me a little bit, but I was feeling those little like jolts, those little hiccups, and I was also feeling rolling and just all kinds of movement all at once, and it was a pretty cool feeling. I just wanted to make note of that. I'm sure baby has hiccuped before, but I haven't noticed it until now. Anyways, back to the video. Last update, I was talking about swelling down there in my lady parts, and so I asked the doctor about it at this last appointment. She checked me and she said that I have some lovely varicose veins down there. Everywhere down there. I didn't even know it was possible to have varicose veins there. I don't think they're internal, thankfully. But they are, you know, all over on one side, and it radiates from my lady parts down to my inner thighs, into my butt, and just kind of all over in that region. It's not on my legs or on my other side at all, it's just in that one area. And it definitely feels very heavy sometimes and uncomfortable, but I wouldn't say it's super painful. I asked if it was a concern at all. She said it's usually only a concern if it's in an area that would tear during birth because it would, you know, gush more blood. She said it didn't seem like that would be a concern for me, so hopefully not. She also checked me. She said my cervix is long and closed, which is perfect. It's what we want right now. So everything seems to be okay. Also at the doctor appointment, I got the glucose test results back and everything looked good. I don't remember what number she said I was at, but it was all good, nothing to worry about. I totally passed, which is great. It means I do not have gestational diabetes. My doctor actually wants to see me every 2 weeks from now on. So I have an appointment next week, and then I'll have an appointment 2 weeks after that, and so on and so forth. Which is kind of interesting because I didn't think that happened until later on in the pregnancy, but she said she wants to see me every 2 weeks from now on, so that's what's gonna happen. And then once we get closer to the due date, like I think a month from the due date, then she wants to see me every week. The due date is something that I mentioned in the last update. My doctor had sent in the measurements and asked to get them reassessed to get a proper, accurate due date, because the first ultrasound they told me I was a week behind, the second ultrasound they told me I was a week ahead, and so we're just really confused on what the due date is supposed to be, and they haven't gotten back to us. Shocker. And my doctor said they probably won't get back to us, they probably won't change the due date, which in my opinion is really stupid. It's making me consider wanting to go to a different ultrasound clinic in the future. My sister-in-law actually just had her 20-week anatomy scan. She was measuring 1 day ahead, and they changed the due date just like that. No big deal, no problem. But for some reason for me, it's like the end of the world to even get my measurements reassessed. So really dumb, in my opinion. We're just gonna stick with the due date for now, I guess. I'm going off of the due date being the 27th because that's what the ultrasound technician told me. The first ultrasound, my doctor's saying I'm due on like the 28th or the 29th for some reason, but I don't know. I'm just saying that I'm due on the 27th, and whatever happens, happens. Baby's gonna come when baby wants to come. I'm just gonna prepare for this baby to possibly come earlier. Oh, and then at the appointment, my doctor was trying to get the heartbeat, and it took her a really long time because the baby kept moving. It would not stop moving. But eventually, she kind of got a bit of a heartbeat, and it was 132 beats per minute, which is actually lower than any of my babies have ever been, which is interesting, but totally fine, totally good. She also said that she thought baby was head down at that appointment, so I'm hoping that is true, and I'm hoping it stays that way up until birth. As far as weight gain goes, I've kind of been like weighing myself every week or so. Last week it didn't look like my weight had changed at all. This morning I weighed myself, and according to that scale, I've gained like 3 pounds. I don't know how accurate that is. Like every time I weigh myself, I'm like sometimes a little bit under, sometimes a little bit over. The last time I weighed myself, my weight just kind of fluctuates depending on the day, what I've eaten, and so forth. So I'm gonna say that I've gained about 17, 18 pounds, which already is more than I've gained with my daughter throughout the entire pregnancy. I only gained 17 pounds. This time I am 29 weeks and I'm already at that 17-pound mark. But I still weigh less than I did with her at the end. So I'm kind of wondering if I'm gonna gain, 10 more pounds so that I am at the same weight that I was then. Who knows? I feel like my body looks pretty similar to when it did when I was pregnant with Eloise at the same time. I've actually been comparing the bellies in weekly bump shots that I took with Eloise and with this pregnancy. And this week the bellies are looking very similar, which is interesting because throughout this entire pregnancy my belly has looked a lot lower and a bit pointier than it did with Eloise. But for some reason this week they look pretty much the same. Speaking of the belly, I'm gonna get up, I'm gonna do a belly shot, and I think that's gonna be the end of this video. Alright, so this is what the belly looks like with the shirt on. This is what it looks like with the shirt up. My belly button looks a little red because I stuck my belly ring back in just to see if it would still go in, and it was starting to close, so there's a little irritation there. But this is what the belly looks like. It's starting to feel very big, very pregnant. It's getting to the point now where I can't really see anything down there. I actually tried to shave down there this weekend and it didn't work very well. I could not see what I was doing. So baby is getting bigger and we are really starting to anticipate the birth. I'm starting to freak out a little bit about the birth, remembering the kind of pain that I was in the first time around. I haven't been nervous for the birth up until this point, and now I'm starting to get a little nervous. I think my biggest fear is just not knowing what's gonna happen. There's just no way of knowing when it's gonna happen, how it's gonna happen, how fast it's gonna happen. That is the scariest thing for me. Anyways, that's everything for this week's update. I hope you enjoyed. If you want to follow along a little closer through this pregnancy, I update a lot over on Instagram. I post pictures of my bump often over there as well. So if you... You know that I'm gonna say bye-bye, don't you? So if you want to follow along a little bit closer, do follow me over there. That's also probably gonna be the first place that I announce the birth. So if you want to be the first to know when the baby is born, which is a couple months away, hopefully, but still, if you want to be the first to know, that's where I'm gonna be announcing it. Anyways, I hope you enjoyed this little pregnancy update and hearing all of the TMI things that are going on with my body. Bye. I will see you guys in the next video. Bye.
If I could take you up and boom, 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 tell me I'm the